Hi everyone, my name's Brianna and I'm an oncology nurse based out of Chesapeake, Virginia. I became a nurse in 2017 when I graduated from Virginia Commonwealth University, and as a new grad, I worked at VCU's inpatient oncology unit, which is where I really developed my passion for this patient population. Since then, I've moved around a little bit and I've seen how oncology is done all across the country. Since just prior to the pandemic, I started working in the outpatient infusion side of oncology. Labs and imaging are a very valuable part of cancer care. This can give us information about tracking the patient's disease, monitoring for side effects, or even looking for specific mutations that may guide that patient's treatment plan. It's common for the oncologists that I work with to order a CBC check midway through a patient's chemo cycle. We expect during this time that their hemoglobin, platelets, and neutrophils are kind of going to bottom out, but then they'll come back up just prior to doing their next cycle of treatment. That's completely normal. So when I'm doing these reviews with my patients, I like to show them what their labs are today compared to what they were on treatment day, so they can see if it's a normal level for where they're at in their cycle. But also if they do need a little extra support, like for their immune system, we can give them something called Neupogen that can just make their immune system less vulnerable than if they weren't on treatment, because we don't want any risk of something called a neutropenic fever. So I truly love what I do, but I am ready to expand on my role, which is why I'm pursuing my FNP to become a oncology nurse practitioner. I would ideally like to stay with my current company and be in the outpatient clinic setting. I am a little nervous about taking on the responsibilities with the provider role, and this would include things like knowing how often I need to order scans that are appropriate to figure out, is their treatment working? Is it not working yet? Or becoming more comfortable with the specific genetic testing that can look for these mutations to guide the treatment plans for those kind of more niche drugs, but work really, really well for patients in that population.